back to another Facebook Live. We're here today to chat about medicine. So a quick recap. I'm Jess. We have Mike in the background there who will be putting some links in the comments below, so keep a lookout for those. And today we're sat here with Karen Grant, who's going to be telling us all about what it's like to study medicine at Lancaster University, as well as what it might be like to apply for, and what it might be like afterwards after studying the degree. So Karen, would you like to introduce yourself more fully and just describe what you do at the university here?
Okay.
Yeah.
So I am responsible for admissions to the medicine degree programme and to our foundation year for medicine. Okay. I also teach within the department. I do quite a lot of the pharmacology teaching in the earlier years of the programme. I'm a PBL tutor, and so I contribute to the teaching, and I'm responsible for admissions, and I'm Deputy Director of Medical Studies, which means I'm kind of second in command for the whole programme as to how it runs.
Oh, great. So
I should know what I'm talking about.
Yes, we've got a great source of information and advice then on the admission side of things and on the teaching side of things, so we'll make the most of that. So if you have just tuned in, I will say send in your questions. As we have on the past couple of sessions, we've got some backup questions here which we'll start with, and then if you do have any follow-up questions to these, do send them in, and I'll keep an eye on the iPad here, but we'll get started with the first one. So the first question is, what do you look for in a personal statement? And the sort of second part of the question is, what activities, reading or opportunities could young people get involved in now to boost their interest in the subject?
So in the personal statement, I think we're really looking for two kind of things. One is that the applicant has got some insight into what a medical career might look like for them. So what is being a doctor like? What are the realities of working in healthcare? And the second thing we're looking for is that they have thought about what skills they might have that might make them suited to being a doctor, and that might be reflecting on what they're studying at school. It might reflect on some work experience they've had. It might reflect on volunteering or sport or music, all sorts of things they can use to talk about skills they might have developed. So they have to always be applying it back to medicine, but it could be things like through my work experience I've learned how to communicate with people, or through working in a shop I've dealt with stressful situations, or through in a sports team I've learned how to work with others and overcome challenges, and, all of those things. So it's two real things. What do you know about what being a doctor is really like, and that needs to be a kind of realistic impression, and what skills do you have and what kind of evidence do you have that you have those skills.
It's interesting to see that you can link those subjects which might not be directly related to medicine into the skills that you get for medicine.
Absolutely. I think a lot of our applicants to medicine they're good at quite a lot of things. They're quite good at all sorts of different things. And that's kind of what you need in medicine, because you need people who are people and scientists, and have a good appreciation of sort of social factors and all sorts of things. So they need to be really quite well rounded. So actually it's great if they can call upon anything that they do out with sort of their studies too.
Right.
But it's about reflecting back on what they know about the career and the skills you need to have in that career.
Yeah, about reflecting on the career, you were saying you need students to have an insight into what a career might look like. How might they get a realistic insight into that?
So again, they have lots of ways that they can do that. We do ask that they have some relevant work experience, and that's a very broad church. So I think they might think that what we mean is go and sit in the room with a doctor and see what they do. And if they can get access to that, that's absolutely brilliant. But actually, they can get lots of other experiences about working in healthcare which are not as difficult to come by. So you can volunteer in hospitals to hand out cups of tea on wards and things, and actually that can tell you a lot about how a ward works, what are the stresses and strains, how busy the staff are, and you can learn a lot from those. And actually that's just a volunteering kind of position, and it's much easier to get to. So there's lots of things that you can learn about healthcare. So it might be through work or voluntary experiences in different kind of settings. Some people will go to things like summer schools where they will get to talk to doctors and medical students, and they will have learned a little bit more about what to expect from those interactions. That's also absolutely fine. And some people will draw upon having maybe read books that are written by sort of doctors, because there's quite a lot out there. And again, some of them they're trying to highlight the challenging, difficult, complex sides of being a doctor, which it's good to have a more realistic impression of what it would really be like. So there's lots of different ways you can do it, and most people within a personal statement would have to not just use one, they might have to use all of those to be able to kind of give you a convincing picture of what they understand of what it would be like.
So using the full breadth of their experiences. Great. For those of you who've just tuned in, we've just been chatting about what they might look for in a personal statement when applying to medicine, and that's included some really great advice there about what kind of things you can do to get a bit more insight into what a medical career could look like. So if you are watching after this is live, you can scroll back and find out a bit more about that, and what you can do to boost your interest in the subject and really be able to really back up those points in your personal statement about wanting to study medicine. So that was some great advice, thank you for that. We'll move on then to our next question. So coming up, we have the question, which is, how competitive is the application process to the subject?
So it is competitive to get into medicine. We have probably, most medical schools will have about 10 applicants per place that they have available. Okay. And they might only interview a third of those and then make offers to a half of those. So it's kind of, it's quite competitive to get in. And that means that there could potentially be people who feel that they've fulfilled all the entry requirements but still aren't successful at getting a position. And I think when you have that much kind of competition to get in, then you are focusing on choosing those who are best suited, who are most academically suited, who have demonstrated the non-academic things that we want them to demonstrate better than others. So it's always a bit of a competitive process. I think the good news is that the government have, in England anyway, have released 25% more medical student places. So from 2019 entry onwards, there's going to be more places coming on board. And if you have 25% more places and you don't have 25% more people wanting to study medicine, it's going to become less competitive. I think it will still be competitive. You'll still have to get good grades at your A levels. You'll still have to demonstrate that insight and be able to reflect on your kind of skill set. But it's going to be slightly less competitive than it's been previously. So I think that's a good news story.
Yeah, definitely good news. And I think there's a lot to be said about knowing. I think applying to medicine, knowing a lot about what kind of career you want to get into. You'll be quite driven anyway to get into that. Brilliant. So for the few people who have just joined us, we've just been chatting about the application process in medicine, but also what it might look like next year with the increased number of places and how that might affect competitiveness. So that's a great thing to go and look back on if you are watching after this is live. Thank you for that. We'll move on then to our next question. Next up, we have the question. What advice would you give to young people who are studying their GCSEs, who are unsure about what they'd like to study in the future? So a lot of the young people we work with are currently at their GCSE level and maybe starting to think about those next steps. What would your advice be to them to help make those decisions?
So I guess there's a couple of things I would say for people who are studying GCSE. If they want to keep medicine in contention, then they need to study quite hard and get good grades in their GCSE. A lot of bright kids can kind of not work very hard and still get okay GCSE grades. But to get into medicine, again, because it's quite competitive, we're looking for better grades. So actually you don't want to kind of end up inadvertently getting GCSE grades that might prevent you being able to follow your dream in the future. So that's one thing, is about stick in, do as well as you possibly can. In terms of trying to explore what you might want to do and whether medicine's the right career for you, I think that's about trying to get some work experience. It's about trying to speak to people who are either medical students or doctors at the moment and ask them about what their job is actually like. What do they do day in, day out? So if you're only 15, 16, it's hard to get any meaningful work experience, but you can still might be able to get chances to speak to people.
Yeah, definitely.
So that might be about, to get to speak to medical students, for instance, you could go to university open days, and I know it's quite early, but you could
Yeah.
still go and have a chance to speak to them. What is it like studying medicine? Often there are practicing doctors there as well as part of the open day, so you might be able to speak to them about what they do in their day job when they're not at a university open day. Then there are other opportunities that you can have, like MedLink. That is also, that's a kind of, it's like a conference where there are lots of related topics about medicine, and so you can go. That would help inform you and help you make a decision. So I guess it's about gathering information, I would say.
Yeah, and making the most of the people around you and their
Definitely.
experience. I like that you mentioned open days, because that's a great chance to speak to people who are currently studying as well, and get a little taster into what the life, outside of the studying part is like as well.
Absolutely.
Brilliant.
I mean, I think open days, I think people think of going to open days just when they've decided what it is they want to study, and then they're just making a decision as to whether they, what universities to pick. But actually, I think there's some benefit of going earlier, and you could just go to your local university, but actually speak to people. If you think, actually I'm quite interested in science, then you could go to people who are studying biological science, physics, chemistry, medicine, biomedical science. Go and speak to the staff, the students, find out more about what the course would be like, just get some information.
Yeah.
It's hard to make a decision about anything in life if you don't really know what your options are.
Yeah, and those people just, ahead of you, they'll have had that insight into what it's like to apply to those kind of things as well. So that's some great advice there. If you have just tuned in, we've just been chatting about, what things you can do now to sort of decide what it is you might want to do. So what advice would we give to young people who are not really sure what subject they'd like to study in the future? And for medicine, the advice is to sort of make the most of the people around you. So ask questions to anyone in medicine or anyone who might be studying it. And one thing we've mentioned is a great opportunity in open days. You might think it's too early now, but it's a great chance to speak to people. And I'm glad you have brought that up, because there are a few open days coming up for Lancaster. I've got them written down here. So there are 2 open days in summer, so that's the 29th of June and the 13th of July, and then there are 2 in September, so the 7th and the 14th. And as we say, that's a great opportunity to come here, chat to students who are currently studying here, as well as see what it's like to live here as well. So that's a great chance to experience the university, and it's also just a really nice day out if you're thinking of it early on. So yeah, we definitely recommend that. Mike will be putting a link to those in the comments below. So if you want to find out more about that, it's www.lancaster.ac.uk/study/open days. One thing Mike's also put in there is the MedLink. So that's a conference you were talking about. That might be a good chance to have an insight into medicine. So you can follow that to find out more about what that's like. Brilliant. Okay, so we'll move on from open days. We'll discuss the next question. It's quite a big piece of paper, so it's quite a long question. Here we go. So what subjects do you expect applicants to study, and what are your entry requirements?
Okay, so we have, at Lancaster, we have some subject requirements at GCSE, and then we have some subject requirements at A-level.
Okay.
So at GCSE, we're looking for 9 subjects in total, and they have to include English language, maths, biology, chemistry and physics, or it could be science and additional science. Okay, so the minimum is 2 science subjects, but it has to cover all 3 science.
Right.
So you can have 2 GCSEs, but it has to cover biology, chemistry and physics.
Okay.
And then the minimum for those 5 required subjects is you have to have achieved a grade B or a grade 6, depending on whether it's the sort of numerical grading. In terms of the 9 GCSEs, normally we ask for 6 A's, which is 7 and above, and 3 B's or 6's.
Okay.
And so that would be your minimum at GCSE, including those 5 required subjects. And then at A-level, we look for 3 A-level subjects, including biology and chemistry. Your third A-level can be absolutely any academic subject. It can't be general studies or critical thinking, but it can be absolutely anything else.
Oh, right.
So we have students who have taken art as their third A-level, and we have a lot of people who take maths, but actually, if I could advise people, I would say don't take a third science, because when you come to study medicine, you do have to learn a lot
Yeah.
of science, but you actually have to learn quite a lot of social science as well. So if
Right.
you've done something like history or geography or sociology or psychology,
Yeah.
they're really useful for the non-science parts that you have
Okay.
to learn of the curriculum. I mean, the thing is to get the grades to get in.
Yeah.
But if you're equally good at all sorts of subjects, then it's good, I think, to take a non-science as your
Oh,
third.
great. That's
A
quite
level.
unexpected. That I
Okay.
didn't think like you could.
Medicine is
choose something.
actually not a science.
Yeah.
It's you use science, but actually a lot of what you have to learn is actually social science. It's
Right. Yeah.
about your patients. It's about the factors that influence whether they're healthy or not.
Yeah.
It's about ethics. So again, religious studies can sometimes be a good thing to do if you've done philosophy and ethics as part of religious studies, because when you come to medical school and you have to learn all about medical ethics, a lot of the things that you've learned in religious
fall
studies
right
go
into
to the
that.
same.
Yeah. Wow, that's a good way of putting it. You use science, but it's a lot about social
Yeah,
science.
it's not really. It's not really a science subject. It's a subject where clinicians use science all the time.
Great.
So, generally what you need to get in is for 2020 entry onwards, because we've
Yeah.
already taken applications for 2019. It will be 3 A's if you're taking 3 A levels, or if you have taken an APQ, or if you've taken a 4th AS, then the offer will be 2 A's and a B plus a B in your APQ,
Okay.
or a B in your 4th AS.
Right.
So 3 A's if you're just taking 3 A levels.
Okay.
So that's the general getting onto medicine course. That's your standard entry requirements. We're also offering something which is called a contextual lowered offer, and that's medicine is trying to diversify, to get more students from a wider range of backgrounds than we have at the moment. And the reason for that is that doctors have to treat everybody in society, and actually doctors themselves should reflect society as it is at a wider basis. But there are some groups within society that face medicinal barriers to getting into to medical school. They might be less likely to get the 3 A's at A level than other applicants, but not because they're less academically able. It's quite complicated.
Yeah.
So one of the things that we're doing is that we have what are called widening participation criteria. So that might be if you're the first person in your family to go to university, if neither your mum or your dad have ever been to university, don't have a degree, or if you come from a low income household, or if you live in an area where not very many people go into higher education. There's all sorts of criteria.
Yeah.
If you fulfil 2 of those, then you might be eligible for what's this contextually lowered offer, where the offer would be ABB instead of 3 A's. So it's a way of trying to attract a wider range of students into medicine.
Yeah, to reflect society, as you said.
Absolutely.
Brilliant. So for anyone who has just joined in, we've just been chatting about what the entry requirements look like and what subjects you might be expected to study. And that goes into, the entry requirements in terms of A-levels, but also your GCSE grades. And we've also chatted a little bit about contextually lowered offers. That's a mouthful, isn't it? So I'm sure you can find out more about these at the Lancaster website. Entry requirements and things.
It's on the Lancaster Medical School website.
Great. Yeah, so Mike will put the Lancaster Medical School website below, so do follow that if you want to just take a note of what those entry requirements are, as well as follow up on what those contextually lowered offers look like. Great, that's brilliant. We'll move on to our next question then. So next up we have, the question is, what have your recent graduates gone on to do?
So Lancaster Medical School's only really been in existence for about 12 years.
Okay.
And when we originally opened, we were delivering a Liverpool medical degree. So the very first people who graduated with a Liverpool degree.
Oh, right, okay. So they studied here,
They
but
studied here entirely, and they had all their clinical placements
Yeah.
in this area, but they were studying a Liverpool University degree,
Oh, okay.
and they were awarded with that. So they graduated, it must have been 7 years ago. So it's not that long that we've had some graduates in the system, if that makes sense. And when you first graduate from a medical degree, you have to do what's called foundation training.
Yeah.
So you have 2 years of foundation training where you're still being quite closely monitored and supervised, although you're still acting as an independent kind of clinician and treating patients, but you're still quite closely supervised because still quite a lot of learning to do after you graduate
Yeah.
about how to sort of act effectively and treat your
Definitely,
patients.
yeah.
And then after you finish foundation training, then students would apply to go into specialty training. So that's where you might decide you want to be a GP, or you want to be a surgeon, or you want to be a psychiatrist. You have to do the specialty training after your foundation training. So we hear back from some of our alumni. It's always lovely to hear from them.
Yeah.
And I heard back from a couple recently. So we've got one of our graduates who's doing surgery at the moment, and she wants to go into the army and do like battlefield trauma surgery. So that's one of the things that she's interested in doing. So the reasons why she was in contact, she was like, will you provide me with a reference? And I said,
nice.
of course. So that's one thing that she's doing. So she's almost finished her surgical training, and that she's ready to go and like super specialise in kind of battlefield trauma surgery. And then another person who, so both herself and her younger sister graduated from here, and she came back when her younger sister graduated relatively recently, and she was saying that she had just got into anaesthetist specialty training at the first round, and it's very competitive, and that she felt that her time at Lancaster had really helped her because she'd done lots of enrichment activities.
Yeah.
She'd been involved in a project that I had run when she was here, that she was going out into schools and doing a bit of health education.
Oh, great. So it prepared her
So
for
she felt that all of those things that she'd done when she was here had helped her to like put a really strong specialty training application in and got in at the first round. So
great.
yeah, so that's a couple of good news stories.
Yeah, that's brilliant to hear. So I'm just interested to know, do students come in to study medicine, do they know what kind of specialty they're going to get into afterwards? Like, do they tend to have an idea, or
So some come with an idea.
Okay.
A lot of people decide they want to study medicine through personal experience. Somebody, either themselves, they've been unwell as a child, and that's kind of motivated them to want to give back into the system. You know, they've seen how well they were cared for and want to kind of give back. And that might shape what they want to do, depending on what was wrong with them. Or somebody in their family, somebody's close to them, has suffered from something and that they want to go. So one of my tutees, he had a cousin who had a heart defect and had to have lots of surgery. So he wants to be a cardiologist. That's what he wants to do. So sometimes they come with very fixed ideas, or not fixed ideas, but they have a definite idea about what they want to do. But sometimes as they go through their training, they change their mind. They find out a bit more about what that specialty really looks like.
Okay.
So cardiology is one of those things that you're such a specialist that you're on call a lot, and sometimes you're because of what happens to people who have sort of heart problems, you're doing surgery under emergency conditions. You might have to. So that has an impact on your work-life balance, and so sometimes people go, I want to be a cardiologist, and then they find out a bit more about it, and they're not quite as sure that they want to do that anymore, and that's absolutely fine.
Oh, great.
And some of them come and they don't really know what they want to do, and they go through, and you have some tutees who just every rotation they go, I love it, I want to do this,
right.
and then they go to the next one, oh no, I love this, I want to do this now.
If they could specialise in everything.
And that's also good because that keeps all your options open.
Right.
But you don't have to make your mind up. You can. Some people will do their foundation training and still have not really decided what they want to do as specialty training, and you can also step off at that moment and just work as a doctor, as a kind of staff grade doctor. You can explore different kind of specialties before you decide you're going to enter into that specialty training. So there's quite a lot of flexibility in the system. And you do have some people who will start one specialty training and then change their mind and go and do something else. That's also completely possible.
Okay.
So, and again, there are some specialties where you do what's called core training first. So core surgical training. If you want to become, most surgeons are specialists in particular types of surgery. So they would do core surgical training and then do specialist, like neurosurgery training.
Right.
So you could do core surgical training, start on neurosurgical training, decide that that's not for you, and come back and go and do another type of surgical training.
Right,
that's all entirely possible.
So there is that flexibility, and enough flexibility to give you time to really decide if a specialism is for you, because they might have an idea, but that could change.
Yeah, and I think it does change for quite a lot of people. Within the undergraduate degree, you get a taste of most types of specialty.
Yeah.
So you get to see what a lot of the different specialties look like, and that helps you to make that decision. And then when you do your foundation training, it's 2 years, but generally you'll do 6 rotations within that, so that you'll try different types.
You'll get a good taster of things then.
It's all set up to try and give them enough information to make an informed choice about what to specialise in.
Yeah, and I think sort of on that note, how do you think that transition from school to university might be for some students, because they get to try a lot of different sort of topics in medicine there. That might be quite new to them. So how do you think that transition looks like? What do you think that looks like?
I mean, I think there's a transition between school and university anyway.
Yeah.
And I think the way that at Lancaster, the way we deliver our curriculum is through something called problem-based learning, which is a form of small group teaching. Okay. There's a lot more emphasis on the students doing self-directed study, and there's a lot more about learning through discussion. So that's a big change from school.
Yeah.
And one of the things that they struggle with in that is the uncertainty. Yeah. So at school it's very certain, here's the curriculum, learn this, if they ask this, say this. And then when they come here, they've got all this kind of more uncertainty about have they learned the right material, and you've got to keep emphasising to them, you're not just learning this to pass an exam, you're learning this because you need this knowledge to be a safe and effective doctor in the future. And so it's a completely different way. You have to learn it in such a way that it will still be there in 20 years' time. It will still be in your head. Yeah,
you can't just forget it as soon as you get out the exam.
No, you really can't. So and that can be a bit of a change. And students do have to adapt the way they learn when they come to university, but we have quite a lot of support sessions built into our curriculum about getting them, especially problem-based learning. It's so different. In the very beginning of the first term, we get them together, we talk about what they're finding challenging, how long they're spending on their self-directed study, how they're going about their revision techniques, and get them to reflect on whether what they're doing is really as effective as it can be. That's also reinforced through the academic tutor meetings. So there's lots of ways in which we try to kind of encourage them, again, to reflect on what they're doing. Is it the right thing? Are they? Yeah. So it's quite a change in terms of learning technique. Then, as you say, there's all sorts of different topics. That is something that if you have done biology, chemistry and maths at A level, sometimes you find that having to engage with social science and psychology more difficult, because it's a very different discipline. The way that they write about knowledge and that discipline is quite different. Yes. And they can find that quite challenging.
Yeah, it can quite change.
So it's I think the ones who cope with it are the ones who are just interested. They're interested in medicine, they're interested in everything to do with people and health. Brilliant. And so they will find ways to adapt.
Yeah, great. And it's good to know that, whilst it might be a change from the subjects they've seen, there are support systems built into the curriculum itself, so you can learn those things from scratch and really build upon the knowledge that you've already got as well. Brilliant. So for anyone new who has joined, and we've just been chatting about recent graduates and what they've gone on to do, and what kind of specialisms they've gone into. So if you are interested in looking into a bit into specialisms and what kind of things you might be able to explore or have a taster in medicine, you can scroll back after this is live and look into more of that. Brilliant. We have had a question come in here. The question is from Mark. Thanks for tuning in, Mark. It says, I was just wondering about placement versus course versus social life balance on a medical degree. So what does the balance look like for students, because they've got things like placement, the actual studying and the social life? What might that look like for students?
So it'll probably look different in each different year.
Yes.
So first year you are based mostly at university. You've got problem-based learning, you'll have anatomy teaching sessions, you'll have clinical skills teaching sessions. You do have some clinical placement in first year, but it's quite light touch. It's like a few days going out into GP, meeting some patients who have agreed to come in and talk to medical students. So it's quite light touch in first year. Yeah. Second year is a bit of a change of pace. Right. So in second year, in our curriculum, they spend 2 days a week in hospitals.
Okay.
So they're actually spending 40% of the whole year in hospital placement.
Wow.
They spend Mondays and Fridays on campus in kind of lectures and problem-based learning and anatomy. And then they have 1 day a week, which is a mixture of self-directed study days and days where they might have to engage in primary care placements, so placements in GPs or in other kind of community placements.
Okay.
Year 2 is probably the toughest year.
Okay.
It's the busiest year that they have, and it's probably the one that they find the transition more difficult than transitioning into first year, the transition from first to second year, just because they're having to be on placement, they're still having to learn for problem-based learning, but they're having to clerk all these patients, write all their cases up, learn how to do that.
They're balancing a lot more things.
They're juggling a lot. And then when they get into third year and fourth and fifth year, it's all based on placement.
Okay.
So they're kind of going through different rotations. In third year, I think they're about 7 weeks in length. So they do one in GP, which is about managing long-term conditions. They do a care of the elderly rotation. They do women and children, which is a bit of obstetrics and gynecology and a little bit of paediatrics put together.
Okay, so they work with quite a variety of groups then.
And in terms of balancing, so their placements from second year onwards take a large proportion of their time in our curriculum. That's not the same in every single medical degree.
Yeah.
So some you don't go into placement until quite a lot later.
Right.
So ours is they're out on placement quite early on. They haven't learned as much, and so it works really well for those who learn through interacting with patients and learn by discussion and all of that. So it's good for those people who learn in that particular way.
Yeah.
In terms of balancing with their social life, I think there is a kind of stereotype of medical students who work hard, play hard, and I think it's definitely true in that they seem to have a good social life, especially here. We're quite a small medical school. The students all know each other.
Yeah.
They have, they organise regular social events. They have a very active MedSoc, which organises a winter ball and a freshers ball and a Christmas ball and all sorts of things. So they seem to have a good social life, but they do work hard. Yeah.
So it's people who are in the same boat, really.
Yeah.
So you can socialise and really get to know them as well.
Yeah.
Nice one. Whilst we were chatting about that, another question came in from Hannah here, and it says, is it more expensive to study medicine than another degree?
So I guess it probably, you will have to take out a student loan for longer. So you will accrue more student debt because you'll have your student tuition fees loan for 4 years rather than 3.
Yeah.
In the final year, the Department of Health at the moment pays for tuition fees, so you don't have to take out your tuition fee loan for that final year. Then you obviously have living expenses for 5 years as opposed to 3 years. So again, that is going to be more. It's going to be more expensive in terms of how much money you will spend overall to get your degree. The corollary to that is you are guaranteed a job.
Yes.
Doctors will never be unemployed unless they choose to be.
Yeah.
There are more jobs than there are doctors, and you are guaranteed to have a job straight out of you're almost guaranteed to have a job straight out of your degree. Until now, every single one of our graduates has gone into a foundation year training post. So you are going to have a job. It's going to be well paid.
Yes.
And it's not a job that's ever going to disappear or go away. We will always need doctors.
Yeah, definitely.
So in terms of risk benefit, yes, you will spend a bit more to get your medical degree, but on the other hand, you are going to have guaranteed good income for the rest of your life.
Yeah, definitely. So those years that might be seen as an extra year of taking out a loan, that's actually an investment in a real secure job.
A really secure job and well-paid job. So
brilliant. Great. So the payback for that is great. Nice one. Thanks for that question, Hannah. I think speaking on the subject of finance and money, we do have the piggy bank guide here, which is great for anyone who might want to study any subject at uni, but this just gives you money advice, what it's like to pay for things after school, and it's got a little insert here as well that's a little bit about student finance, and you can find that online at www.thepiggybank.org.uk, and that will just give you some advice, and it'll also sort of break down some of those finance terms which might seem a bit confusing once you get out of school. great. Thanks for the answers to that question. We have 2 more questions left in the bowl, so we'll move on to those. I think we've answered anything that's come through. Brilliant. Next up then, we have the question. We've talked a little bit about clinical placements, but it would be good to know just broadly what role do clinical placements play on the course?
Clinical placements really are your bread and butter. So medicine, again, is different in that a lot of your learning is not done in a classroom environment. So first year is the year that looks almost like another university degree. There's more lectures, there's more kind of classroom teaching. But after that, a lot of your learning is through what we call experiential learning.
Okay.
You're out, you're learning about how a ward works, you're learning to interact with patients, you're learning to take a history from them, and then that is then the stimulus for you to learn more, because you would take a history from a patient, and part of what you would have to think is, what do I think is wrong with this patient? What might be the diagnosis? What might be the differential diagnosis? So you then have to go and do a bit of learning.
Yeah.
You might have to look some things up to work out what that might mean. And then you're presenting to a consultant who will then give you some feedback about what questions you should have asked, what things that were really significant in what the patient told you that you might not know yet because you're only a student. So it's about how. So a lot of your learning is actually done on the placement, interacting with patients, interacting with doctors.
Okay.
And so that the clinical placements, they're not a kind of a cherry on the top. They're actually the filling of your sandwich. They're the substantial place where you're doing your learning.
Yeah.
And it's a very different type of learning, because you're learning how to interact with people, but you're also learning how to do a case presentation, which is basically how junior doctors in a working life might take a history from a patient and then feed it back to the consultant and say, this is what I've found, this is the information I've found, this is what I think is happening, and the consultant might say, you need to go and do this test, you need to ask them this question.
Right.
So they're actually learning professional skills about how they can do the job in future.
Great.
And it's in a way that they learn by doing it.
Yeah.
You give them some structure as to how they should approach it, but actually a lot of those things you can't really learn how to do it apart from by just doing it.
Yeah, definitely.
So clinical placements they're actually a massive part of your degree. They're where you do a lot of your learning.
Yeah, and in that sense as well, like they're learning in that environment that they're eventually going to work
Absolutely.
in. So they're picking up all those skills from that. Brilliant. For those of you who've just joined, I've just seen another question that's come in, and we'll get to that. We've just been chatting a bit about clinical placements and the role that they play on the course, and how they're like the bread and butter to the course, really, and how much experience and learning you can gain from that experiential learning. But the question that has just come in is coming from Harriet. And the question is, would studying medicine at a non-Russell Group university affect chances of employment after? So would studying medicine at a non-Russell Group uni affect chances of employment? So looking at...
I don't think so. So the degree you get from all the medical schools in the UK is exactly the same degree regardless of what university you've got it at. And it entitles you to enter any specialty you like. So the world is still your oyster.
Yes.
I don't think that they will look at where you got your degree. They will be more interested in what experiences you have, what additional things that you have gone and kind of done to show sort of an interest in a particular specialty. As I said before, we have graduates who have gone and got into really competitive training programs, and they haven't been disadvantaged by having attended a non-Russell Group university. So I don't think it makes any difference personally.
Yeah. And as you said before, it's not like when you go into exams, you're not forgetting that information. It's about all that information you get and the experiences that you have that really make you a strong applicant for employment afterwards. Brilliant. We do have one more question left in the bowl. I'm just going to scroll through and make sure we haven't left any questions out. Brilliant. Great. We'll get to the last question then, and that is... okay, so what do exams and assessments look like in your subject?
Oh, okay. So in medicine, you have to be able to master the knowledge, but you also have to demonstrate that you're competent with all the skills that you need to be able to be a doctor. So, and the way that our curriculum is set up, we're doing that from the very beginning. So students are learning clinical skills in first year, so they have a clinical skills exam in first year. So in first year they will have 3 written papers. Okay. 2 of those will assess their knowledge and understanding of the medical sciences that underpin medicine. And then the 3rd written paper will assess the social science, their understanding of study design, their understanding of population health, understanding of sort of professionalism and ethics. So all of the non-medical sciences is in a separate paper. Okay. And then on top of that, they have their clinical skills exam. So that's called an OSCE, an Objective Structured Clinical Exam. Okay. And that's where they have to demonstrate that they can perform clinical skills. So they might be asked to examine an abdomen, they might be asked to take a history from a patient, they might be asked to do a urine dipstick analysis, all sorts of all the skills that you need as a doctor, and they have to pass that practical exam as well as the knowledge and understanding papers. So that's the structure of first year. Second year is very similar. In third year, the papers are sort of slightly different in that we start to ask them slightly different styles of questions, but there will still be 2 papers that are on medical sciences. But the medical sciences will now include things like investigations and management and diagnosis, rather than just like the science, if that makes sense. So it includes the kind of clinical sciences as well as medical sciences. They will have a 3rd paper which covers the kind of non-science bit, and then they'll have a clinical skills exam. And then in 4th year, they have 2 clinical skills exams. Okay. So they have the OSCE, which is the one where they have to demonstrate that they can do lots of different skills. So they might have 13 or 14 different skills to demonstrate. And then they have it's called Lancaster Clinical Assessment, LCA. Okay. And this is a much longer assessment. So they have to do 6 interactions of 45 minutes. Wow. Okay. And it's with real patients. In the first 15 minutes, they examine the patient or take the history from the patient. Then they have 15 minutes to write it up and work out what it all means, and it might be that they've got to come up with a management plan, or they have to come up with all sorts. So they will have something to do, write it up, and then they have 15 minutes to present to a clinician. Right. So that's very much structured around what they will do day in, day out. That's very much structured as in you see a different patient every 10 or 15 minutes, and you have to decide what you're going to do with them. Yeah, you've got to work under pressure in that sense. And as I say, it's using real patients, so it's very much kind of decided that it's the most close to real clinical practice that you can get. Okay. Then in year 5 in our degree, they don't sit any exams. Their assessment is through portfolio, so they go through 5 different rotations, and for each rotation they have to write up some cases, they might have to write up a critical incident, they might have to write up a scientific report. There's all sorts of different things for the different rotations, and that's assessed as in, is their knowledge, understanding and clinical practice where it should be for practice when they graduate. So it's a very different way of being assessed in the final year. It's all done through kind of portfolio. In 5th year, they also have some external exams to take, which are not related to the degree. So they have to take something called a situational judgment test, which is used as part of what determines where they get their foundation training post. They have to take a prescribing safety assessment, which, depending on where they go when they graduate, what job they get, they might have to pass before they're allowed to prescribe independently. And then for the people who are joining medical degrees now, they will have to take a kind of standardised national exam, which will cover both the kind of clinical elements and kind of knowledge and understanding. Okay. And that's something that the General Medical Council are kind of rolling out as a national exam to check that all graduates are at the same.
And that's across the board.
So that will be across all medical schools. Right. But there's still quite a lot to be sorted out. Yeah. So I think they're planning on rolling that out in 2022. Okay. So we've got a few years to see what that really looks like, but that will be in addition to what people are doing at the moment.
Well, it sounds like, from the first year, the assessments are split up in a sense to cover all aspects
Yeah.
of everything you'll be doing in that kind of job. So you're talking about the medical science side of things, and then the sort of the non-medical science side, as well as the practical side of things. So it's covering all aspects and skills that you'll need. So they'll be well qualified by the end of it, definitely. Brilliant. I think that was a great question to end on. Really practical overview of what that looks like. And I think that's the end of the questions that have come in as well. Just like thank you so much for bringing all your knowledge and advice. It's been really useful to know. This will be available after this is live, so please do watch through and follow the links that are below. And once again, thanks very much for coming to answer some questions. And we'll see you next time, which will be tomorrow at 4. Thank you.